Welcome once again to our Thursday evening training. I hope that this finds you well into the month of February and working towards achieving your goals. So, from wherever you are joining us, my name is Betty OLOO, a long-time New Life distributor, and very glad to be able to spend this time with you on a Thursday evening to talk about our products and how to position ourselves in order to help the people we come across. So, whether you are a new distributor just joining the business for the first time or the first few months, it's a very warm welcome from us. And I hope that you're going to find the session today useful to you. As you might have seen from your invite, the session is once again a Q&A. We periodically have these Q&As just to be able to respond and discuss some of the questions that you sent to us. So because we have got quite a number of questions to get through, without further ado, I'll just get into it. So these questions were left over from last time. A person wanted to know what to recommend for someone who's struggling to conceive. And the first thing I wanted to say is that problems to do with conceiving have various causes, and our products can only help in some of them. So, our products would help usually if the problem is related to nutritional deficiency or to hormonal imbalance. So, a couple should try as far as possible to eliminate unhealthy foods from their lifestyle, and they should also take up healthy lifestyle exercises just to ensure that their bodies are in good condition. Also, try to resolve stress and eliminate stressors as much as you are able. On the product side, what I would recommend would be Herbal Feminine Complex, vitamin E, and Pro-Vitality. That would be for the woman, and of course, it takes two to conceive. So we would also recommend that for the man, we have Herbal Masculine Complex as well as chelated zinc. So the husband and wife can share Pro-Vitality if they so wish, because it is important that they are in good nutritional status in this particular venture. So, of course, our best wishes for these people, and we hope and pray that by using our products, they'll be able to receive the gift of a child. Then the next question was about hemorrhoids, wanting to know what to recommend for hemorrhoids and what causes hemorrhoids. The first thing I would like to say is that severe cases of hemorrhoids would require surgical intervention in order to ease the discomfort and to help along the recovery process. So the cause of hemorrhoids would be chronic constipation or diarrhea. The pressure as one is either struggling to pass stools in constipation or during the diarrhea can, if it is a chronic situation, end up in hemorrhoids. So on the lifestyle side, I recommend minimally processed carbs in their diet and plenty of cooked leafy vegetables. Usually, cooked leafy vegetables are easier to digest. Also, we can recommend their fruits, which have got fiber in them, and this will help with loosening the stool so it is easier to pass. We also recommend you deal with food sensitivities, which can sometimes cause the stomach to be upset and lead to diarrhea and things like that, chronic diarrhea. It could be that something in your diet is disagreeing with your system and causing these issues. Then also ensure adequate hydration, because water is very important in our digestive processes. And also just to be aware that certain medications can worsen constipation. And so if you are on some chronic medication for something that is going on with you, it would be a good idea to find out from your doctor if it is this medication that is causing you to constipate and struggle to pass stools. Then we have supplements that can help. We have stage 6, a herbal preparation that helps to lubricate and loosen the stools. We also have fiber tablets, which would be important in supplementing the dietary fiber that you are taking in your food. We have chelated zinc, which helps to heal internal wounds. And we can also add there aloe vera plus, which helps to just relax and support our digestive system. Then the next question came from a number of places, and this was neuropathy or nerve pain, or it also manifests as burning sensations in the hands and the feet. Neuropathy or this nerve pain is often linked to diabetes because it comes from some of the damage that diabetes does to the nerves in our extremities, the hands and the feet. But it can also be due to injuries, it can be due to toxins and even nutritional deficiencies. So, what we recommend for neuropathy will be magnesium complex. We'll also recommend vitamin B complex and omega 3 salmon oil. And I think it would be a good idea to check if you are pre diabetic or diabetic, just in case you are not aware. And that would mean that if you find that you have blood sugar issues, either it is still in the early stages of prediabetes, then add botanical balance and the TRNN to the recommendation so that you get to the root of the problem, which would be the diabetes. A number of people also wanted to know about sickle cell anemia. One was for a child and the other was for an adult, so I'll give recommendations for both. But just to be aware on the lifestyle side that this is a chronic genetic illness that has got episodes of a lot of pain and can have various manifestations in the health of a person. For the child, we recommend to ensure, and also for the adult, hydration is very important. So make sure you are drinking a minimum of 3 liters of water per day. It does not have to be all at once, just to make sure that water is a part of your day-to-day intake. Then we also recommend that if you live in cold climates, try to keep warm either when it is cold or when the weather is cold. And this is because cold tends to worsen incidences of joint pains in the fingers and the toes in children and also in other parts of the body. So for a child with sickle cell, we recommend Vita Squares, we recommend omega-3 salmon oil minis. If they are too small to take the omega-3, then I would recommend that you pierce the capsule and squeeze the contents into their food. We also recommend Neolife Shake, especially during or after a sickling crisis. So when they've been quite ill, you may find that their appetites are very poor. And so Neolife Shake is going to give them a good boost of protein intake so that their body is able to rebuild the damaged places. Just to say that sickle cell anemia tends to do a lot of damage in the body because of the breakdown that is done to the blood vessels. So Neolife Shake will help in the recovery process during or after a crisis. And also we can add their VitaGuard. So those four would be the staples for a child, small child with sickle cell anemia. For an adult, the same applies. Of course, the adult will have lived with the illness for a while and may be better able to manage their conditions. If you have got maybe a young adult or a teenager who has sickle cell, then it is important to help them to learn how to take care of themselves so that they know what can worsen the problems and what they need to do in various cases of a crisis. So for the adult, we recommend vitamin B complex, which helps in building of blood. Remember that this condition, the blood is defective, so there is a constant need for making new blood, and this means that vitamin B complex will be very important. We also recommend Pro Vitality, which contains the good mix of basic supplementation, including omega-3, which will be in there, TRNN, as well as carotenoid complex and multi. So Pro Vitality will be a good addition, together with chelated zinc for helping to heal the damage caused by a crisis. And again, Neolife Shake, especially if the appetite is poor and they need a protein boost. And magnesium complex will also help in relaxation because sometimes during a painful crisis, it may be difficult to relax and get to sleep, and magnesium complex can help. This does not mean that the supplements alone are going to be enough. I recommend that you have a doctor or a pediatrician who will help you to manage the pain, because this is a condition, an illness that actually is often quite painful. So have a doctor with whom you can discuss pain management, so that when there's a painful crisis, you know whether to manage it at home or to go into hospital, and at which juncture it is indicated that you should be in hospital, where they can receive IV fluid and IV painkillers and so on. So those are the recommendations. I know that one person recommended that we have a talk on sickle cell anemia. I think that I've given this talk to a number of groups. So if you would like us to have one for your group, because maybe you are in an area where sickle cell is quite common, then just let me know and get your group together, and we can go into further details of sickle cell anemia. And this is because we have a son who has lived with sickle cell anemia. He is now 30. He is now 33 years old. And so we have got quite a lot of years of living with the illness. But of course, as an adult now, he's also more aware of the need for taking care of himself. So next question was someone who was saying they have a craving for millet flour. And I don't know what to make of this, because whole millet is a very nutritious grain. So I would say that maybe just incorporate millet as part of your diet, because it is an excellent grain. It's much better than many of the other grains that we have in the diet. So how about replacing all the wheat products in your diet with millet products? You probably find that it is quite beneficial. If you find that you need to take supplements, then I would recommend multimineral alfalfa and Provitality. So that is basic supplementation that can help just in case there are some gaps in your nutrition. But I think that millet flour is highly to be recommended, because it is a small grain that is very nutritious and is rich in fiber, rich in minerals, and rich in nutrients. So, all in all, in my opinion, that is not a bad craving to have. Just make sure that it is not processed. You can buy your own grain and mill it, or you can work with farmers who grow millet if you're in a country where millet is grown, and have them supply you with the whole millet flour, and then make that a part of your diet. And since it's something you crave, you'll find that at least you can eat something healthy, which you also enjoy. Okay, next question was about what to recommend for varicose veins. So varicose veins are the swollen veins that tend to appear, especially on the calves, the legs, and they are difficult to reverse. Once they develop, they would require surgical intervention. These days, there are some non-invasive surgical interventions that can be done to remove the varicose veins. It is unfortunately something that can run in families. So if you have a familial history, maybe your mom or a dad or other people of your family have it, you have an increased chance of also having varicose veins. It is also more common in overweight people and in people who live a sedentary life where they have to sit for long periods. So in the lifestyle side, we recommend that you try to maintain healthy weight. We also recommend to avoid sitting for prolonged periods, and you can also use compression stockings when you need to sit for long. Let us say you're on a trip and you have to sit, let's say, in a flight or in a bus for a long period. Then you can get compression stockings from your pharmacist, and this will help to support the pressure of the veins in your legs. For prevention, if you have a familial history of varicose veins, or if it's in the early stages, you have started noticing those damaged veins in your calves, then we'd recommend flavonoid complex, multimineral alfalfa, and omega-3 salmon oil. Then someone wanted to know what they can use for eyesight problems. Again, this was from a number of people, and they did not specify exactly what the eye problem was. So just a general recommendation. The first is avoid prolonged eye focus, in poor light. So let us say it's a young person who is studying, or someone who, for one reason, in their work situation, they have to focus for prolonged periods, then try to make sure that the lighting is good and that from time to time you look up from your work so that you change the focus of your eyes to relax the eye muscles. Then, of course, avoid prolonged staring into screens without taking a break. Try to take a break from time to time so that your eyes can relax. Then, the new life supplements that will help with this will be vitamin A plus D. We recommend carotenoid complex and we recommend omega-3 salmon oil. So, those three to support generally eye issues. Then the next question was about what to recommend for endometriosis. Again, endometriosis is an autoimmune condition. It can run in families. So if the women in your family have a history of this, you also may have it. And it's where uterine tissue can start growing in other parts of the body outside the uterus. It can lead to heavy bleeding. And what we recommend on the lifestyle side is either supplement with vitamin D or get good sun exposure. We also recommend avoiding junk food because it worsens the symptoms. The products we recommend, apart from vitamin D, if you're not able to get good sun exposure, is Cruciferous Plus, omega-3 salmon oil, multimineral alfalfa to help with replenishing the body, especially if you have heavy bleeding. We also recommend herbal feminine complex to support the woman's reproductive hormone system. Then someone wanted to know what to give a small child who is eating stones and sand. Chronically, they like to eat stones and sand. Of course, sometimes children will put non-edible things in their mouths. So this was not just an incident of a child taking a mouthful of dirt or stones, but that they keep on doing this. So what I recommend here will be the children's supplements, Vita Squares. I would also say you can use multimineral alfalfa, just cut the tablet in half. And if the child is very small, you can grind the tablet into and put it in their food. So that, because a lot of times the eating of stones and sand is usually that there is a need for minerals. And in a growing child, this can be that the child is not getting enough minerals in their diet. So apart from multimineral vitamin and Vita Squares, you can add vitamin C. And sun exposure is very important for growing children. So as much as possible, do that. If it is not possible to do that, then definitely add vitamin D to the supplement. Vitamin A plus D and vitamin D are small capsules which are not difficult to swallow. But if the child is not able to swallow, then once again, prick the capsule and press the contents into their food. But it's a good thing that once children reach about 5 or 6, so they should be able to swallow at least small tablets and small capsules. The next question was someone who wanted to know what to recommend for kidney problems. So here on the lifestyle side, we recommend ensuring that that the person is well hydrated, eliminate unhealthy foods, and minimize toxin load by eliminating habits like eating junk food, smoking, excessive intake of alcohol, because the kidney is one of the chief detoxifying organs in our bodies. And so if the kidney is struggling, then it means you need to help it by not overworking it, trying to detoxify with anything you're putting in your body. Kidney problems are often linked to high blood pressure, which damages the very small blood vessels in the kidneys, and also type 2 diabetes is another culprit that leads to kidney problems. So just to be aware and to get tested to see that your blood pressure is normal or is normalized, because we have supplements that you can use for that, and to see if your blood sugar metabolism is okay. And if not, we also have supplements for that. Then generally to support the kidney, we recommend vitamin B complex, we recommend multimineral alfalfa, flavonoid complex, and also beta-GAD. Then someone wanted to know what to recommend for, I think it's a young person whose bladder muscles do not work and they are therefore not able to pass urine. So here, the first thing, lifestyle points: exercise to strengthen the muscle. There are exercises for lower abdominal areas like the Kegel exercises. And we also recommend being well hydrated because it means that the detoxification is hampered by this issue. And so taking of water and being well hydrated will be important. I am not sure to what degree this can be assisted by our supplements because I'm not sure what could be causing the bladder muscles to be defunct. So anyway, just in case it is something that can be nutritionally assisted, we recommend flavonoid complex, we recommend vitamin A plus D and vitamin C. But I think that trying to find out if those Kegel exercises can help in strengthening the lower abdomen muscles, since the bladder muscles are in that area, probably that can also assist. Another question was about liver failure. So on the lifestyle side of liver support, we recommend that you eliminate sugar and alcohol. Remember that to the liver, both sugar and alcohol are the same. So someone who is overusing alcohol or taking too much sugar are hurting their liver in the same way. So eliminate sugar, eliminate alcohol, and minimize your toxin load. And also, if you are taking chronic medication, remember that all medication are treated by the body as toxins and have to be detoxified by your liver. So one more reason to maintain a healthy lifestyle, because then you do not have to take these chronic medications, which can be overtaxing your liver and even your kidney. Opt for healthy fats because the seed oils or the factory fats are often problematic for our systems. Then, to support liver health, we recommend amidone, which has got some amino acids that support the liver in its recovery and in its health. We also recommend vitamin B complex, we recommend flavonoid complex, and vitamin D. As I said, if you are able to get good sun exposure, then you may not need to supplement with vitamin D. But if you can get good sun exposure, then of course our skins are able to make vitamin D when exposed to the sun. Then the next question was someone wanted to know what to recommend for demyelination. So demyelination refers to a situation where the nerves in the body which are supposed to have a covering of fat. So normally our nerves, especially once we reach the age of 25, are covered in fat. The fat is important because it helps to speed up the rate of nervous activity. But there can be illnesses where there's a fatty tissue that is supposed to form a sheath around our nerves is destroyed through an autoimmune reaction. So the autoimmune system damages the myelin sheath, which is a fatty sheath that covers the nerves, because it treats it as a foreign organ. So some autoimmune illnesses, such as I forget just now the particular one. I think it's multiple sclerosis or a different one, can lead to demyelination. So here what we can do is, first of all, support your immune system. We have a topic about supporting our immune system, which is going to come around in the cycle of product training. We also recommend that you supplement with vitamin D, vitamin B complex as well, and omega-3 salmon oil. And also you can add aloe vera plus. Then, okay, there were a number of questions about ulcers. So peptic ulcers, gastric ulcers, duodenal ulcers, and ulcerative colitis, that is ulcers in the colon. So all these usually will more or less originate from the same issue. Ulcers in the gut can be due to things or habits that inflame the gut. One of the culprits will be a bacterium called H. pylori, which takes advantage and can attack the inner lining of our gut. Also, painkillers that are called non-steroid painkillers that we take over the counter, things like Brufen, aspirin, and so on. If we take this on an empty stomach, they tend to corrode the gut lining. And once the gut lining starts getting corroded, it becomes easy for it to be perforated. And then bacteria like H. pylori can actually worsen the condition. Some of the habits that are problematic with these ulcers of the digestive tract are smoking, as well as alcohol overuse. So get rid of those habits. You may need to see your doctor for antibiotics to fight the H. pylori. And then also avoid taking these painkillers as much as you're able. If you have to take them, then make sure you never take them in an empty stomach. Have something to eat, even if it's something small, so that they protect your gut from corrosion. Try to resolve stress, because one of the ways in which stress contributes to ulcers is by causing damage to our gut in reaction to the stressor. Then some people indicate that raw cabbage juice helps to give a short-term relief when the ulcer pain gets very bad. So raw cabbage soup, juice. The supplements we recommend for this is to help to heal the gut. Remember, I said that the gut needs to be have a strong lining in it, and we should avoid things like foods that disagree with us and substances that cause the gut to get inflamed. So do use chelated zinc, which helps in the healing of internal wounds. We also recommend garlic allium complex that is antimicrobial and will also help with fighting H. pylori in the long term. But remember, do first use antibiotics, and you can use garlic allium once you have finished your course of antibiotics as an ongoing support for your gut health. And aloe vera plus is also a tonic that helps to soothe the gut as it proceeds to heal itself. Make sure that your diet is one that supports gut health. Again, gut health is a topic that we have separately. So if you suffer from ulcers or your client does, then when we announce that we are having at the topic of gut health, then you can invite them to listen in. Someone wanted to know about whether we have probiotic supplements in the Neolife range. We do have the Acidophilus Plus. Unfortunately, it's not available in many markets. And so what we recommend is we take the prebiotics. So they were asking about probiotics, but Neolife does have prebiotics, which are fiber tablets and multi-fiber blend. These supplements are the preferred food for the beneficial bacteria that live in our colon. So by taking fiber tablets and by taking or multi-fiber blends, then you'll be supporting the friendly microbes in your gut, and that way they are going to increase in number. Of course, you also need to take a diet that has got plenty of, does not have to be a huge amount of fiber, but do take things like leafy fruit, vegetables that are cooked. If you have gut issues, it's better to take cooked vegetables. You can also add there certain fruits like apples and so on, which have got a good mix of fibers. And as I've said, the reason why this is a replacement for probiotic supplements is that then you're feeding the beneficial microbes so that they increase in number. And as they increase in number, they keep down the population of harmful microbes that will be in your system. And another person wanted to know what to recommend for chronic allergy. They did not specify how the allergy is manifesting itself. So I'll simply give a general recommendation. Try to identify and, if possible, avoid or eliminate the allergen. That is the thing causing the allergy. It's not always possible to do so, but if it is, do try to eliminate it or avoid it as far as possible. And then follow a healthy diet, because an unhealthy diet does tend to drive and worsen the allergic reactions. We will recommend from the Neolife side, generally for allergies, omega-3 salmon oil that helps to resolve the inflammation that accompanies allergic reactions. We also recommend flavonoid complex and vitamin C, all of these that help the body to resolve allergic reactions. But of course, if you are still exposed to the allergen, then you may find that you continue to struggle from time to time. Then someone wanted to know whether our Neolife home care range is organic and whether it is safe to have to get skin contact with them. Just to say, of course, the skin contact is safe because a lot of our products our home care products are used by hand. And I think the reason why there is that point about skin contact is that there was cases of people drinking care solution for gut problems, and the company has been strenuous in recommending that people do not take care solution internally. Reason is not that it is toxic, is that remember, it is an antimicrobial, which means it's going to kill the good and the bad microbes, all of them in your system, which is not a good thing. Otherwise, our home care range has a very high safety standard. They are biodegradable, they do not exude toxic fumes, and do not contain any harsh chemicals. So, as to the organicity of it, I'm not certain about that, but I do know that those 4 points are there. They are biodegradable, meaning that they do not harm the environment. They are non-toxic. If taken by mouth, of course, they will not poison you, but as I've said, of course, the home care is not supposed to be drunk. So, care solution, for instance, should not be taken as a cure for gut issues. We have other supplements and medications for that. And also, our home care range does not have harsh chemicals. So, skin contact with the home care range for use as recommended will not cause problems. Then someone wanted to know what to recommend for an enlarged prostate gland. And here on the lifestyle points, we will say maintain a healthy weight. We also recommend emptying the bladder completely, regularly, and also include activity in your lifestyle. So, of course, general healthy points. And then, of course, on the Neolife supplements, we recommend highly Cruciferous Plus. That is very good for prostate health. We also recommend chelated zinc and herbal masculine complex. So those are the 3 supplements in addition to the lifestyle points. Then a person who had a lot of issues that they asked about. What I'm not quite sure about is whether the issues were happening in the same one person. So what I decided to do is to give a general recommendation if that one person is having all these different issues, and then discuss the issues themselves one by one. So the person seems to be suffering from a variety of inflammatory issues and general body pain. And for the general lifestyle, what we'll say is eliminate all unhealthy foods and habits from your diet, because all these things drive the inflammation that lead to pain and poor health and damage to our joint, damage to our gut, damage to many of our systems. And in addition to all that, tends to aggravate and stress our immune system so that we end up with the autoimmune issues. So clean up the diet, ensure that you are not taking any junk food, eliminate problem foods like sugar and maybe even dairy and wheat and the factory oils. So opt for healthy choices that will support health. Then base supplementation for this person, if it's simply to deal with the issues of widespread problems in the body, we'll say Provitality, vitamin D, and magnesium complex. So some of the issues that they had was arthritis. They did not specify which kind of arthritis it is. If it is osteoarthritis, then they'll need to take full motion and CalMag, and they'll add to that either omega-3 salmon oil or Provitality. Provitality does contain within it omega-3 salmon oil. If it is rheumatoid arthritis, this is an autoimmune condition in which the immune system attacks the joints and joint tissue. So it is important to avoid triggers and support the immune system. Avoid triggers if you are, as far as possible. Support your immune system so that it does not cause these attacks. Then use full motion also, Provitality, multimineral alfalfa, and vitamin B complex. So that is for rheumatoid arthritis. There was also in the same question migraine. So if you suffer from migraines, or if this person, in addition to arthritis, has migraines, then check with your doctor in case there is an underlying issue. But try to eliminate triggers. There are some triggers for migraines. It can be things like cheese for some people, wine for others, and hormonal changes for others. For example, some women, when they're undergoing menopause, do tend to have migraines as part of the menopause symptoms. And the supplements we highly recommend for migraines, number one will be omega-3 salmon oil. We'll also recommend CalMag and vitamin B complex. Question about blocked fallopian tubes. So the blockage in fallopian tubes can be due to scar tissue from sexually transmitted infections, or it can be due to endometriosis, which we spoke about in a previous question. And also, if there has been surgery to close the tube, sometimes it can lead to scar tissue that remains there. So for blocked fallopian tube, we recommend flavonoid complex, we recommend chelated zinc, and recommend omega-3 salmon oil. If the person with a blocked fallopian tube is trying to conceive, there may be a need for surgical intervention if the supplements do not bring about the hoped for result. Then there was also a question about hormonal imbalance. There was no clarification as to how it manifested. So I assumed it might be a woman who has hormonal imbalances. This usually can be linked to PCOS, polycystic ovarian syndrome, which is linked to diabetes and sugar issues. So if this is the case and I'm answering the question as you wanted to ask it, then have your blood sugar issues checked, and then use herbal feminine complex, magnesium complex, and vitamin D. And then lastly for today, someone wanted to know about endocarditis. So endocarditis is inflammation of the inner lining of the heart. This would be due to infection. The infection could be coming from the blood itself that is being carried in the blood, or it could be originating from our teeth and gums, so from oral health. You remember when we speak about oral health, we say that it is very important to maintain oral hygiene and oral health, because the bacteria that cause infections in the mouth and teeth can actually travel in the blood and go to other places and start problems. So, of course, the first thing with endocarditis is to be in the care of a doctor to get the infection dealt with. And then in your supplements, we'll recommend garlic allium complex, which is an antimicrobial, flavonoid complex, and omega-3 salmon oil. If your budget allows it, you can also add there coenzyme Q10, which supports heart health. So I see that it's time for me to hand over to Pascal to take you through the next session. I've stolen quite a number of minutes, but it's all in an effort not to have too much of a backlog of questions from the Q&A. I hope that you have found the session beneficial and that we've been able to answer your question to your satisfaction, and that through this training and other training that Neolife is always giving you, you will be able to better support those who come to you for health as you build your business and make the world a healthier, wealthier and happier place. So it's all my best wishes in the next week. I'm looking forward to seeing you again next Thursday, God willing. But here is Pascal now standing by to take you through the next session. Thank you and good evening.